that people move quite a long distance to access the services. For example, one is moving around 80 kilometers to and 80 kilometers away to from the facility, meaning that in a day he's going to travel around 160 kilometers to access dental services. And majorly, these facilities are offering services like extractions, and they are not doing restorative treatment. They are not doing any other procedures that these people be in need of. So basically, those are the problems that we are finding out there in our communities. Our goal is to reach out to the most in need with our services, quality services that suit international standards. We intend to reach to the most in need, someone who is in the most underprivileged state, and again someone who is underserved. We reach out to them, and we hope that we can reduce the oral disease burden in one way or the other. We hope that at least we can we can impact communities by causing them to be literate about the oral health or oral health care, and we can prevent these diseases within these communities. So that is our goal. Our goal is to make sure that we reach to the most in need and prevent the problems, and to those who are already affected, we can give the services whereby they are either curative or they can restore health. Yeah, basically, one of the challenges are very many. For example, we move long distances, and we end up facilitating, finding it expensive to facilitate the transportation of the dental equipment, and dentists accommodating them within those communities. Two, we find people who do not know what is the solution to their problems. For example, people are illiterate about dental health, what is the cause and what is the solution. And so we labor much to explain exactly what is their problem and what is the solution. And then again, we always find a challenge of overwhelming numbers. For example, we always carry a team of around 6 dentists, but you find that in a day you have to look at a big number of clients. For example, 250 clients, 300, and so it is always a bit challenging because it basically compromises the service if we were to attend to everyone. So we end up leaving many unattended to. We've been finding challenges of inadequate equipment to work on everyone, but we really put in a lot of effort to use the available equipment to make sure that we really serve everyone that we come to meet in these communities that is in need. Sometimes we find it hard to some communities where acceptance is a problem. People have the problem, we have the solution, but acceptance because of mythical perceptions. People have mythical understanding of the cause and solution to dental problems. So we end up still laboring a lot to explain the mythical, to help them understand that it is not the mythical perception, but something else that brings their problem. So those are basically the challenges that we are finding.
What message do you
to the community and the leaders, I really appreciate the effort they have put in place. I appreciate the dentists, but I must pass a message, deliver a message to them that there is a big space in as far as oral health is concerned. I feel there is much more that needs to be done, more effort, more to do with oral health education. So I would advise basically people in health, dentists, to take that extra effort to reach out to communities, reach out to people out there, and explain to them more about the causes of dental problems, and explain to them more about the solution to the dental problems. And if possible, maybe the government